Our speaker tonight has been working with seniors and their families for more than 15 years in variety of settings, including seniors affordable housing, assisted living, skilled nursing, and acute care. And now, aging in place.
Thank you very much. So it's a pleasure to be with all of you tonight virtually. I was telling a colleague of mine that, I think one of the things that's been a unique experience, and I think, Cecily, I think we were talking earlier about this, that, we've all sort of had some birth by fire and learning how to connect with each other remotely. And I think there's a lot of pros and cons, but a lot of interesting benefits to be able to connect with so many of each other from the comfort of our own living rooms. So tonight we're going to be talking about aging in our own space. And before I put my screen up, I just, by show of waving, so we don't have to unmute, I always usually start this talk by asking folks, how many of you have thought that you would like to stay in your own home as your needs potentially may change in the future?
Rebecca, at the bottom of the chat function, we actually have a ability for people to say yes or no.
Oh.
Let's see if people want to answer your question.
Well, so I'm seeing a lot of people going like this and saying that, yes, the plan is we want to stay in our own home, right? So I always ask the follow-up question. So how many of you have a plan that you've thought about to do that? I'm seeing less hands waving, still a few, but less hands. So that means we're in the right place. So let me share my screen here. All right, is everybody able to see my screen? Yes, all right, great, wonderful. So just a little bit about my background. I'm a social worker by background. I've been working, as been said, with seniors and families for about 15 years in lots of different settings. And one of the reasons I think this topic is so important to talk about is because oftentimes, like we just went through the exercise, many people say they want to age in their own space and stay in their home. But very few people have really thought about a plan on how to do that. And I think it's important that we kind of go through all the different elements of what this means and how we can come up with our plan. So aging in place really means, being able to stay in the home of our choice as long as we're able, and being able to access whatever services that we might need as needs change. Right? We know that many times for most people that whether it's changes in our functional health because we're experiencing some physical changes, or maybe that we are finding that we're providing care to a spouse or a partner, that sometimes that our needs change and we might need a little bit of extra help. And the decision to do this requires advanced planning. What I've found in my practice with folks over the years is that the lack of planning really often increases the risk of unintentionally moving into a facility setting if that was not the plan. And thinking about all of these different elements of what do I need to think about in a plan really looks at not only our environment where we live, right, our home, the services that we can get at home, not only healthcare services, but also community-based services and transportation services, but also looking at the financial picture, right? I often say that long-term planning is sort of thinking about like in a triangle and coming up with our idea of what would be our needs, what are our preferences, and what can we afford. And really looking at those three elements and how do we really put those pieces together. So I want to talk a little bit about our home environment, right? So there's four big things that we need to think about in order to consider our environment, our home. The first one is how easy is it for us to get in and out of our home, right? Thinking about how would we get into the house, thinking about from the moment you come in the door to the moment you're leaving the door, right? How easy is it to do that? Do you have a lot of stairs to get in and out? Now I know you guys are in Canal Walk, which probably has a lot of features built in. But thinking about, if you needed to use any type of assistive equipment, what would you be able to do that safely? Would you be able to do that easily? How easy is it to move around inside your house, right? Inside, whether it's getting to the laundry, getting to the kitchen. This brings thinking about easy access to the things that we use and we need every day. Things like in the kitchen, where are your pots and pans? Do you have things up on a top shelf? Are they, do you have more things that are in easy reach, right? Where do we use things that we use every day? And then thinking about home safety for everyone in a home, including pets. I don't know how many of you have pets, but what I found is that invariably the cat likes to get right in front of my feet, and I think it's a game to her to try to see how quickly she can dart in front of my feet and see if she can trip me. You know, so thinking about home safety, if we needed to use any equipment, if we needed to, think what kind of adaptations might we need to make in the home. So we talk about some common modifications, and I use the word modification to mean any type of adaptation, whether that is a device, whether that is some type of installation of a piece of equipment, whatever that might be. So some common areas to think about. And again, oftentimes we're having this conversation, and like we are tonight, that everyone's doing pretty well, right? We're doing pretty well, we're active, we're healthy, we're living our life, you know, maybe a little bit differently in light of COVID than we were, say, 6 months ago. But thinking about in the future, as our needs may change, that what kinds of changes might I need to be able to make? So common rooms. The first one is the bathroom, probably the number one room where people make some type of change. Thinking about looking at grab bars, shower chairs, you know, a handheld shower head. That's a really easy fix to be able to improve safety. And, you know, thinking about in the bathroom, having adequate space to move around. If we had to use any type of assistive equipment, such as maybe a walker or a wheelchair, even if this was temporary, if you've ever had any type of joint replacement surgery, or you have unfortunately had a fall or something like that, you might need to use some type of equipment on a short-term basis until we get back to normal. And thinking about in the bathroom, do you have adequate space to move around? You know, one of the things that I often talk with people about is, you know, everybody loves to have the little bath mats and the little decorative shelves and things like that, but those are, can be a great thing to try to trip over. So maybe we need to think about if we need to remove that. And then in the kitchen, right? So the two big rooms, bathroom and kitchen. You move the stuff that we use on a regular basis to a lower shelf. I always say the name of the game is safety. We want to minimize the risk for a potential fall as much as possible. So do we need, you know, we want to not try to use step stools if we can possibly avoid it. You know, so move the things that we regularly use to a lower shelf. If anybody has arthritis or has had any difficulties with their joints, sometimes turning a knob or grabbing onto a handle can become painful if we're having issues with that dexterity and that movement. You know, I said there were a few days last week when the humidity and it was warm and it was raining, and that oftentimes if you have arthritis, those may not have been as great a days for you. So consider installing a hands-free touch type faucet that you just have to touch that rather than turning a knob. If you have knobs on your kitchen cabinets or any cabinets really, consider changing them to a D-shaped knob. You can sort of see the you know, example picture here versus having a knob. They're easier to open and easier to grab. Moving to your common spaces, one of the things, if I could find the people that make throw rugs and put them out of business, I would be very happy. Because throw rugs are a #1 risk for falls, because every single throw rug, if you think about the rug you might have in your kitchen to the one in your bathroom, they invariably either curl up on the ends or they bunch or they slide, and they're very easy to trip over. So trying to get rid of those throw rugs. If we have higher pile carpeting, change it to a lower pile carpeting, because if we need to, again, to use any type of equipment, it won't roll as smoothly over the high pile carpeting. For the phone, I know many people have a cell phone, and if I were talking to 20-year-olds, I wouldn't have to say this, because many 20-year-olds, the cell phone is surgically attached to their head and to their palm. They always have it with them all the time. So, but oftentimes for those of us who know how to function without having a device in our hand all the time, that oftentimes we may not have our phone with us. So if this is Thinking about the wireless phones, if you have a landline in your house, that consider using the multiple wireless phone system, that you can put a handheld set at different places throughout the house, so that in God forbid you needed to call for help, you'd have easy access to a phone. I'm not sure if any of you have stairs, or most of the condos, are you on level, or do you have stairs? So if you have stairs, thinking about putting handrails on both sides of the stairs. You know, if you don't have stairs, then disregard this conversation. But if you do have stairs, thinking about, let's see here, I see that, go back. All right, so we say that, you know, having the handrails and things like that. You know, if you do have a stair, and if you might need a stair lift, you know, that is another possible type of device to install. If you happen to notice that you might be experiencing changes in hearing, that happens to the best of us, you know, that oftentimes if we're experiencing these changes, that we may not hear the doorbell, or we may not hear the smoke alarm, or the carbon monoxide detector. So if you're noticing that you are experiencing changes in your hearing, you may want to consider installing the doorbell or smoke alarm that have a visual alert. They have a light pulses to help alert you that you might need to pay attention to that alert. Okay. Move to next. So again, I asked you before to think about how you would get in and out of the house. And in thinking about if you had to use any type of equipment, even as I said, short term, you know, how would you get in and out? You know, depending upon your door setup, you know, that you might need a little bit of a wedge, of a ramp. I often say, you know, to some folks that have, you know, these houses that have multiple steps outside, that, you know, sometimes the ramps end up looking like lawn furniture, that they're these big types of things. But you may just need a little bit of a wedge, and you see in the top right corner, it's a little rubber wedge that you can actually buy them on Amazon and Home Depot, things like that, that would just are a little bit of an incline to get in and out of a door. If you had to use any type of equipment, or you have a knee replacement, and doing that little step might be difficult. For many of us, if we have issues or changes in our breathing, things like experiencing asthma or COPD, or any type of breathing issues, that if you have long hallways, or if you have long ways to walk, sometimes adding seating in a long hallway can help provide a place to sit and rest if you need to. You know, that having a place to sit down and take a break. You know, sometimes people have multiple landings or long hallways, that this may be difficult if we need to stop and pause. The other thing I suggest is, if you have, you know, when you're coming in the door, one of the things that, you know, we talk about is, if you've ever done what I call it, the doorway shuffle, you know, for, you know, finding your keys, you know, for if you have, you know, many women, we always lose our keys in the bottom of the pocketbook. That's always invariably where they are, you know, and trying to open the door, trying to carry in packages, trying to do multiple things at once, that increases our risk of experiencing a fall. So having a chair, or having a shelf, or have something where we can put things down so we can focus on just getting the door open, can help reduce our risk of a fall. Having automatic lights, something that's set on a motion sensor, to be able to increase visibility. So when we're coming home, that we're able to have lights, or we're walking in the door, that a light will turn on without us having to reach for the light switch. All right. So oftentimes this is probably the big question that I get, saying, oh, there's all these great ideas, but what works for me, and what should I change? And usually most things are pretty simple fixes, right? You know, if you're installing a handheld shower, whether a shower chair, you know, grab bars, things like that, those are pretty simple things to fix. But some equipment may involve more involved installation, things like if you needed to have a stair lift. Some folks, you know, depending on your community, you may have the ability to install an elevator, accessible tubs that have the door on them. You know, those obviously increase, you know, the cost, and also the involved in terms of installation. Many of the 55 plus communities already have a lot of aging in place designs built into spaces. Some folks have one floor living. You may have grab bars already installed. You may have lighting, things like that, whatever it might be. You know, so thinking about what would work best for you? Well, the answer is that everybody is different. And the needs might be different. So there are lots of different types of professionals that can help you come up with an idea of what might be the best thing for you. Occupational therapists can be helpful. There's a specialty designation called a Certified Aging in Place Specialist, or a CAPS, can help identify things that might be helpful for you to change, both now, but also thinking about the future. And some of these folks also can help coordinate any work that might need to be done. Right, so thinking about the home environment, and that's sort of the first step in coming up with our plan. The next piece is looking about how we can manage things in the house, right? So smart home, right? We're all sort of learning a new virtual world of Zoom, but many people are looking to smart home devices, things like the Amazon I won't say the word because sometimes people have some of these devices and they wake up when I say it, or the Google H device. That you can ask them to do different things and involve that type of technology. And there's a lot of different products that are coming into existence that are really utilizing these types of technologies to really, you know, offer another layer of support. Some folks find that they help to improve their independence and can do all kinds of crazy things, manage lighting, you know, and manage temperature, appliances. I remember years ago, you know, my husband came home with an air conditioner that was connected through Wi-Fi, and you could connect it through Amazon, the A-word device. And I looked at him, I said, what in the world do we need this for? Are you kidding me? And he said, yeah, but you know, it'd be kind of nice to be able to, you know, set it up so it would automatically turn on and off and tell it what to do. And I thought he was a little bit crazy. But you know what? As the weather got a little bit warmer and we started getting used to it, it was kind of nice to be able to set things up. So, you know, you could kind of engage in that kind of technology. A lot of people are using these devices to help monitor home safety. You know, as you might, I have a couple of families that are using this to help monitor some daily activities to kind of make sure and setting up reminders. I have a couple of families that they use this device to help remind their loved one about when to take medications and, you know, when to turn on the TV to watch a certain program. You know, I think that this is sort of one of the biggest evolving areas that we're going to see in the coming years. You know, as well as I think we're learning right now that there's opportunities to help improve socialization. You know, I think if someone would have said to you 2 years ago that, you know, you'd be sitting here and having a meeting tonight where everybody is in their living room, in their office, in their own home, and we'd all be connected, you sort of would have said, well, maybe, I don't know. But, you know, we're sort of learning a lot of new technologies to help improve socialization while we're physically distancing. So, and someone said Wi-Fi light bulbs are programmable. Absolutely, the light bulbs and controllable through a phone app. It's sort of interesting to see every time we turn around the new devices and new things that are coming out, you know, tied into many of these products. I met with a company recently that is developing their own type of system for home monitoring specifically for seniors, and setting up sort of a package that sets up different sensors throughout the whole house. And that's sort of their project. I'm also working with, you know, for those of you who may be caregivers or no caregivers, the United Way of Northern New Jersey has a caregiver coalition. And they have a grant program that they are helping to install the Amazon or Google devices into people's homes to help support them as caregivers and help connect them to technology from caregiver to see if that's effective. So I think, again, it's a growing sort of evolutionary world. And as part of that, we found that, you know, there's a couple of types of technology that have been around for a long time that are getting an upgrade. So one of them is the medical alert system. And I'm sure most of you have heard of Lifeline and things like that. You have the silly commercial that I've fallen and I can't get up, right? That's sort of everybody knows. And a lot of these older versions of these systems, they relied upon the user triggering the system by pushing the button. And over the years, I've had a lot of folks that said, well, you know, either they would take the device off and they would leave it somewhere and wouldn't put it back on, which that's not helpful. Or they would say, you know, I had one lady that said to me many, many years ago that she said, well, if I fall in the shower and I'm not pushing that button, I don't want anybody to come find me in the shower, right? So it's sort of the idea that we rely upon the person. And what happens if we're not able to? What happens if we hit our head and we're not able to push the button? So the newer versions of the technology, some of the systems have motion sensing technology that can help detect a quick downward motion if someone's experienced a fall. Some of the systems, I mean, ironically figured out that, hey, people like to leave their house. And maybe when they go for a walk, they might need to call for help. So they now have GPS tracking so that these devices work outside the perimeter of someone's home. And some people also figured out that maybe people don't want to wear the big bulky button that everybody sort of knows what it is. So they offer more of a stylish pendant or bracelet. What's interesting is the new Apple Watch also has a fall detection component built into it, because they also figured out that young people also fall and might need to call for help. So that's also another product that people can consider. You know, I mention this because one of the things that I've always said to my patients over the years is that especially if you're living alone, there's a sense of peace of mind to be able to say that in the event that I needed help, I could access help in case of an emergency. And I always say you know, it's better to have it and never ever need it than to need it and not have it. You know, most companies, it's all pretty much the same, the basic system of what they offer. Some of these different services are add-ons. But again, if we're living alone, just to be able to know that we could access help, it's just something, again, planting the seed of an option of another resource to think about. I'm sure many of you know there's lots of different types of health technology. And again, this is a growing area as well. Things like all the smartphone apps, the wearable technologies like the Apple Watch and the Fitbits and all those types of technology. Some of these devices are excellent at helping us keep track of our own health and well-being and kind of keep ourselves accountable. And, you know, I don't know if anybody has one of these devices. Sometimes I know my watch often, you know, will say to me, get up and take a walk. You're sitting too long at your desk. And it helps to keep me accountable to make sure I get my steps for the day. But oftentimes there's also opportunities that some of these devices can help create reports that you can bring to your healthcare provider to help, you know, them be good partners in your care. So many of the, if you're diabetic, many of the, you know, testing devices, some of the pulse oximeters, the blood pressure cuffs help to keep track of your blood pressure, your blood sugar, so that you can bring that to your next report to say, hey doc, here's sort of my average of the last few months. You know, again, technology doesn't have to be high-tech things. It can be low-tech things. You know, even one of the things that I mentioned to folks is that, you know, low-tech things can be like the reachers or the grabbers. Those can, or magnifying glass, that's sort of the low-tech stuff. The high-tech goes all the way through like the A devices, the Amazon A devices and other things like that. But it really is about what you feel comfortable with. And if you're comfortable, you're open to exploring some of this, that there's a lot of opportunity to help increase our independence and to help keep track of our own health and well-being. How many folks have a smartphone? I see some heads nodding, right? Most of us have a smartphone. Some folks are just really don't want the smartphone. And I can understand that too. Sometimes it makes us less smart, I feel, at times. But, you know, if you have smartphones, I always say there's an app for everything. You know, there's lots of apps to help keep track of prescriptions, your medical history. If you use a local retail pharmacy like a CVS or Walgreens, you can actually monitor your prescriptions and order refills straight from your phone. You know, there's lots of these different apps. Sometimes you can share that data with your healthcare provider. You know, here with Atlantic Health System, if you use an Atlantic Health System physician, you may have heard of something called MyChart, which is our portal for us to interact, and we share lab results and things like that with all Atlantic Health System physicians and labs and providers. So that's sort of a online patient record. that we use as well, and that you use an app, then you can access through the internet as well. If you happen to be a caregiver or you know someone who is, there's lots of apps out there for caregivers as well to help keep them organized and to try to keep everything straight about appointments and medical history for the person that they're caring for. So I kind of want to move a little bit now to the idea of the services to help us age in place. We've talked about the home environment. We've talked a little bit about, some of the assistive technology, but it's important that we talk about the services to help us. And this is oftentimes where people start to think about, what do we need to, what services may be helpful. And I see some people are saying that, Tim is saying that public transportation, mass transit can certainly help non-drivers. And we're going to talk about transportation in 1 second. That is probably in the top 5 of questions that I get on a regular basis is about transportation. And I always say that there are some transportation options. They are definitely not perfect. It is not the same as getting in your car and getting and going as on demand as you want to. But there are, options out there for transportation. So when we think about aging in place, right, we're going to think about the services that can come to us and the services that we could seek out into the community. So the types of services that can come to us are things like home health care, home delivered meals or groceries, and the assistive technology like we just mentioned. The things in the community would be things like local senior center, the programs that you have available at Canal Walk, social service programs, and things like that. So I want to mention a little bit about home care because, again, it's probably in the top 5 to 8 questions that I get on a regular basis. Home care is probably the #1 service that people may engage as they age in place to help provide support should their needs change. And home care can be anything from having a home health aide to nurses, to rehab therapists, to social workers that come in and provide additional services in the home. Many times for people who have home care, these are folks who are recovering from some type of surgery or hospitalization, and that's why they're getting home care services, or those who might need some ongoing assistance because they have some physical or functional challenges or need a little bit of supervision and assistance because they've developed memory issues or cognitive impairments. As I said, it's probably the #1 service that people engage, and it can help people stay at home as opposed to moving into an assisted living or skilled nursing facility, especially if they don't have family or folks who would be able to help provide that care at home. The part of this question that I get quite often is about Medicare, and I see some questions popping up. Oh, good, thanks, Bruce. We'll get to some big questions at the end here. So Medicare covers very short-term home care that's usually following a hospitalization or an illness. The physician has to order this, and there's very strict clinical criteria that the person needs to meet to be eligible for home care services covered under Medicare. Medicare does not cover what we call custodial home care, which is the kind of care that comes on a daily or regular basis to help with personal care because the person needs some assistance because of functional issues or memory changes. Most home care services is an out-of-pocket expense. In New Jersey, the average cost of what we call this custodial type of home care is about $25 to $27 an hour. Most agencies that provide this type of care, usually like a 3 to 4 hour minimum visit per time that they come, just to kind of keep that in mind. Again, we talked about the triangle before, right? We talked about, needs, preferences, and finances. This is sort of looking at also the financial piece too. Okay, so the other part of this is, again, we're talking about the community resources, right? We've talked about the things that come to the house and talked about what are the resources here in the community. So looking at what are senior centers, what do you have available at Canal Walk? What types of, do you have health classes, in non-COVID times, right? In normal circumstances, we're all living in a sort of an alternate universe right now. But looking at what are some of the, resources that are available for both fun, Volunteer stuff. You guys were saying before that, you've made some contributions to some food pantries, and, what are the opportunities for us to engage socially, because that's an important part of this. What do the community or nonprofit agencies in your area offer? Do they have assistance with bill paying? Do they have counseling services? Do they have volunteers who might be able to help with transportation? People mentioned before about transportation, and I always challenge you to think about, if you were not able to drive, even short term, where would you find information about what services would be available to you? There are a bunch of different resources. Many of them require reservations. Many of them require that, you kind of are in a fixed loop, of transportation. Sometimes they're a bus, sometimes they're car service. One of the services that I've had a lot of people utilizing over the past, couple of years that they really seem to like is, those of you who don't use smartphones, there's a program called Go Grandparent. I don't know if anybody's heard of this, but this is a company that has figured out that some people don't use a smartphone or don't feel comfortable using a smartphone. And this is a company that provides a phone-based interface for Uber and Lyft. So it's called Go Grandparent. You sign up for the service and you can pick up the phone and say, hi, I'd like to go to my doctor's office located at ABC. And they will then dispatch an Uber or Lyft driver. And the driver also knows that they're picking up someone who might need a little bit of extra time. And, many people seem to like this service. Looking at faith-based communities, what's available. Many times, a lot of faith communities have services just for members. They have volunteers. They have, lots of different resources available. And then the last part that I always talk about is about meals, groceries. I'm sure that someone said before, maybe Cecily, you were saying before that, we're all becoming gourmet chefs, right, during this time, because what do we have to do but learn how to cook and learn how to take on this. But I think this has probably been one of the big questions I've gotten in the last couple of months is about grocery shopping. A lot of folks are a little bit reluctant to go to the grocery store, and the traditional shop from home services were very difficult to get a reservation or a delivery time. There was a little bit of disruption in the beginning, but it seems to be back up and running again. Many counties offer what we call the Meals on Wheels type services to folks who have a difficult time getting out. I always say that, Meals on Wheels, it is a daily meal that they will come and provide. It is not gourmet. So have a realistic expectation, but it is a daily meal should you find that you need that. The grocery stores, again, I think once we return to a little bit of a sense of normalcy, that they will be offering more and more of the home delivery. I see that coming. But again, also in regular times that, this service can be very helpful, because if you've ever lugged the cases of water or, wanted to, order a lot of different things, they can be helpful because they bring it right to the house and can bring it right to the door. So just kind of thinking about that as a resource. So moving to the next component of this is looking at social support, right? And so social support really involves looking at, our what types of resources would be available to us, in terms of our social circle. And the majority of seniors who decide they want to age in place engage the support of their adult children, siblings, neighbors, friends. And because this is sort of our natural helpers, right? These people are built into our community, and, they're sort of the people that we turn to. I always say, that if you found that you were driving and you got a flat tire, who would you call besides AAA? But, who would you call to reach out to if you needed something, or if we got sick, that it would be oftentimes family. And these natural helpers can be a really wonderful resource, but it's really important that we have open and honest dialogues about mutual expectations. And I say this, and I'll give you two situations that I've had over the years. The first was I had a gentleman who came to see me a number of years ago with his two daughters. And his two daughters, they were really very well-intentioned. They really were. But they had decided that, they noticed that their father was having a little bit of difficulty kind of managing cooking, and housekeeping wasn't as up to par as it had been in the past. And they said, you know what, that's it, Dad, you're coming to live with one of us. And his response was, as I'm sure many of you can imagine, he said, I don't want to come live with you. I want to stay in my apartment. I've been here for 10 plus years. He had friends there. His girlfriend was there. He didn't want to leave. And we said, how could we address the concerns that were legitimate concerns, but also be able to provide the support that he needed? And the other story I always tell is that many years ago, I had a woman who called my hotline who said, I went to Florida to go visit my mom, and I noticed that she was struggling a little bit. And she said, hey, Ma, would you ever consider one of those assisted living type places? She's like, my mom turned around and looked at me and said, well, sweetie, I always thought that if I needed something, I would just come live with you. And she said, I don't know if I can tell my mom that she can't come live with me. Oh my gosh. Like, I don't know, but it's my mom. And she also had 2 teenage kids at home. And she said, I just don't know that I can do that. And I said, well, it's important that we sort of have that conversation now than before she's in the guest bedroom down the hall and it's just not working out. Right. What I tell a lot of my clients over the years is that if you have adult children are usually pretty well intentioned, but they have lots of opinions about how you should be doing things. So if your decision is that you've decided you want to age in place, it's important that you tell the important people in your life that that's been your plan. So that's how they can help support you in your plans and also maybe be helpful when engaging other services. You know, I've had a lot of families that come and see us together, and you know, many times that it's important that we make sure that in the context that I work, that, you know, my patient's voice is the one that's being heard and not their adult children, who sometimes are very opinionated, I think is a nice way to say that. And again, it's usually well-intentioned, but it's important that we're having these dialogues about expectations, right? The social worker in me, I also feel that it's important here that we talk about things like loneliness, and also our mental health and well-being, especially in light of everything that's going on in the world right now. Many times, and this is also probably in the top 5 of questions and things that I hear from folks, is that many people, especially in the past few months, have experienced loneliness from time to time. And what's interesting about loneliness is a feeling. You know, and I think we've all sort of heard the adage that, you know, you can be in a room full of people but feel completely alone. You know, because loneliness is a feeling, you know, some people have said to me, well, this person is isolated. And when I've had a number of referrals over the past few months of concerns about someone who's isolated, who doesn't have access to get out and to visit with other people, or doesn't have people that are checking in on them. And, you know, when I talk to the person, I've had a couple of people that are like, look, I'm okay. I don't need to talk with other people. They're consider themselves to be more introverted, and they're kind of comfortable with it, and they don't necessarily want to engage with other people. So they don't feel lonely, even though they might be what we consider to be isolated. They don't feel lonely. Whereas I've had people who, you know, they've been with they're in a house where they, you know, have many people who are living there, and they're not what we would call isolated, but feel lonely. So it really comes down to our level of personal satisfaction and feelingness of loneliness. When we feel lonely, we know that this helps to increase our symptoms of feeling depressed. It actually increases our feelings of being that we don't feel good. You know, that if, you know, we're experiencing things like depression, you know, depression, anxiety are very real things. They happen to the best of us at any age, at any point in life. I've met with many of my older patients over the years who say things like, well, this is just sort of how it is. And you know what, the reality is that it's not, you know, it doesn't have to be that way. We can feel better. And that's sort of the bottom line. We can feel better. These are very real things that affect our mind and our body. You know, depression and anxiety can arise from life events. They can certainly arise from world events. I'd be surprised to find someone who hasn't had moments of anxiety or a little bit of depression over the past few months as we've been socially distancing, and that feeling of, oh my gosh, you know, but we certainly know that it can come from the ups and downs that happen in life. You know, the chemicals in our brains are genetic, right? If we had challenges with anxiety or depression or feeling lonely when we were younger, that as we get older, we might experience a recurrence of this. That's actually very common. So it's important that we're sort of keeping in tune with our mental health and well-being as a component of this. So I thought it was important that we mentioned very kind of briefly about, in light of COVID-19, obviously we've all had some significant changes in our daily life and, you know, our routines and what we're doing. And it's important that we're maintaining physical distance when we're out and about in the world, and we're wearing our mask and we're using our precautions. But just because we're limiting our physical interaction doesn't mean we have to stop our social interaction. And I think that that's an important distinction. Seeing that you're all getting together tonight, and I think the last time I saw here that we had 54 households on the call, which is fantastic, that everybody's kind of taken that time out of their evening to kind of get together. So we can do a lot of things virtually. Is it the same as in person? No, but it's kind of better than sitting by ourselves and saying, I don't have, you know, any kind of interaction if that's something that we want. So we can do video chats, we can gather online. I know some of you may have done this with family members who are further away that we can't get together and see on a regular basis. You know, reading a book to grandchildren or friends over the phone, or doing a video chat. I know I've been doing a lot of these with my niece and nephew, reading books to them. And it's sort of become a nice part of the routine that we wouldn't have necessarily done before. Sharing our memories, right? If anybody has, you know, a box or a drawer of pictures or photos things that you've been meaning to get through, these are sort of the world has presented an opportunity for us to kind of get to some of those projects that maybe we hadn't felt we had time for before. You know, take those pictures out and, you know, kind of share, or, you know, scan them, send them, kind of go through things with family. You know, or if we want to be more physically active, thankfully we have the opportunity to get out and go to the parks and kind of be out a little bit more, as long as we're socially distancing. You know, but if you want to do some more activities online, there's lots of different fitness routines on YouTube, and, you know, can sort of do a Zoom class together with a buddy. I'll talk a little bit in a minute about our new Vitality program, which is our senior health and wellness program through Atlantic Health. We've been doing a lot of free exercise classes and meditation classes through Zoom, which has been very popular with people. So as we sort of get to the end here, I want to talk a little bit, you know, about some of the organization important documents and the financial component. And then we'll you know, kind of open things up for questions. But probably the number one piece of advice I can give to people is to get yourself organized. You know, with not only the idea of long-term planning, but also in the event of an emergency, the last thing you want to be doing is searching for important information. So whether it's a binder, a book, a box, a drawer, whatever works for you, gathering that important information and storing it in a safe and accessible place. So getting together things like medical information. Who are your doctors? Who are your specialists? What medications do you take? Who prescribes what? And the pharmacy information. Do you get certain medications from your home delivery pharmacy? Do you get them from your local retail pharmacy? And your medical history, right? Your healthcare documents, advanced directives, which I'm going to talk about in a minute. Health insurance, your copies of your insurance cards, if you have a supplemental plan, if you have a Part D plan, what plans do you have? Your legal documents, will, power of attorney, financial accounts and locations. Oftentimes this is one of the big areas that people kind of say to me that, you know, they don't want to put the financial information together. And I always say that, you know what, you don't necessarily have to disclose how much is where. I had a lot of people say to me, I don't want to tell my kids what I got, right? And I said, that's okay. We don't have to necessarily disclose the balance, but know where the accounts are located in the event that we needed to. Where's the safety deposit box? Where's the key for that? Where are the accounts located? I was working with a family a number of years ago that unfortunately their mom had developed Alzheimer's disease. And mom had a wonderful little habit of every time a new bank was opening and offering, if you put $50, $100, whatever it might be, every time that they were opening a new account, you got a free toaster, a beach towel, umbrella, whatever it was. That was what she gave to everybody as Christmas gifts. So she had multiple locations of multiple accounts across 3 different states. And unfortunately, they were in the process of trying to apply for Medicaid, which there's a financial look back and you have to provide 5 years of financial information. So that was quite a little bit of a nightmare, trying to go back and do some excavating and some undercover work of where all these accounts were located. So putting that information together. Social Security statements, pension information, deeds, leases, all the good stuff. And copies of any life insurance, long-term care insurance, which I'm going to talk about in 1 minute. So I do want to spend a minute here and talk about advanced directives. I'm going to assume that everybody on the call is over the age of 18. So all of us should have advanced directives, right? And if we're under 18, when you turn 18, you need to make sure you have some advanced directives. So advanced directives are a combination of 2 different documents that really tell healthcare providers what kind of care that you would like in the event that you were not able to speak for yourself. And it typically includes a living will, which is the document that outlines your preferences for things like CPR, for artificial respiration and ventilation, things like that. And then the name of your healthcare decision maker or healthcare proxy, or sometimes it's also called healthcare power of attorney. This is the name or the names of the people that you have appointed that you trust to be your voice if you were not able to speak for yourself. This is appropriate for anyone over the age of 18, regardless of your health status, because you never know. All of us, I think, have had a little bit of an eye-opener in the past few months in light of COVID. You know, I know I work with colleagues who work in the emergency department, and one of my nurse practitioner friends that works in the emergency department at Morristown was talking a lot about how they were having a lot of these conversations with younger people because of COVID. And I think all of us have really highlighted how important these conversations and these documents are to have, because we just really never know. So there's some great resources. If you don't have these directives made, 5 Wishes is sort of, I call this it's a very in-depth, touchy-feely type of document that outlines, you know, that what kind of music would you like playing, you know, what kind of, you know, what would be some type of food, or would you like aromatherapy or things like that. And then the Conversation Project offers lots of wonderful resources about thinking about how do you start the conversation for yourself if you want to talk to your loved ones about your preferences, or how do you start the conversation with someone else about their preferences. So both of those are really wonderful resources to start that conversation. I do want to mention POLST. Has anybody heard of this document before? A couple people have. So POLST is sort of advanced directives on the next level. POLST stands for Practitioner Orders for Life-Sustaining Treatment. And what's different about this type of advanced directive document is that it's a medical order that's completed here in New Jersey by a physician or nurse practitioner that details the person's wishes regarding their end-of-life care. And I tell people to think of it like a prescription. Just like the doctor writes a prescription for your medication, this is a prescription for preferences at end of life. And this document is just like advanced directives are for people over the age of 18. POLST is sort of a special document that is designed for people who live with some very complex medical issues and are probably in the last few years of their life. And the document itself, because it's a medical order that the doctor or nurse practitioner completes, it represents a larger conversation with that healthcare provider about goals of care. Things like, it actually says right in New Jersey, it says right on the top of the document, goals of care. And that goal could be anything from, I want to be comfortable, and whatever it looks like, that's my ultimate goal. So use any measures to keep me comfortable. To, I've seen directives that people say that their goal is they want whatever kind of care is going to help them you know, live to get to see their granddaughter be married next year. So it's very personal, and it's sort of a comprehensive document that outlines goals, but also addresses typical things like resuscitation, ventilation, and what kind of medical interventions that we might like. What's interesting about a POLST document is that because it's a prescription filled by a doctor or nurse practitioner, it's valid across many different settings, including valid in the hospital, in the ambulance, in rehab facility, in any type of healthcare facility, and at home. Whereas advanced directive also at times is a larger kind of document. Sometimes people have them prepared when they get their will prepared. They have it sort of done as a package. This is a separate document in New Jersey. It's on green paper. So it's easy to find, and it's a medical order that's valid across multiple different settings. If you have questions about Pulse, I encourage you to speak with your doctor about it. As I said, it's designed for people who have lots of complex medical issues that we think are in their last few years of life, that it's important that we start having these conversations about goals of care. Okay. All right, the last piece that we're going to talk about is probably one of the pieces that people have lots of questions about, is the financial component. This is probably, you know, a big area that many people have questions. And I put this part in red because it's probably the area that I get questions about on a weekly basis. I just had a conversation with someone about this today, is about paying for long-term care. Medicare and Medicare supplemental health insurance plans do not pay for long-term care. Most long-term care costs are something that we pay for out of pocket. You know, as I said before, Medicare may cover some home care services for those who are recovering from surgery or hospitalization or an illness, but it's very short term. People have to meet very specific criteria. The physician needs to order it, and it's very, very, it's not what we call like custodial type of care where we're caring because people have ongoing needs. You know, the other question that I get oftentimes about what's the difference between Medicare and Medicaid. I always say, I don't know why we had to name them similar things because everybody gets confused. But Medicare is, think of it like Medicare, like care, like health insurance. This is our federal health insurance program. Medicaid, like aid, is a program that helps provide some financial support for healthcare and other needs. So care, like healthcare, like health insurance, Medicaid, like aid, like financial aid. I hope that helps to kind of help a little bit. So if we're looking to pay for long-term care, right, again, this is any type of care that's going to help us, whether it's we need help at home, any type of care in a community setting, whatever it might be. There's a couple of different resources thinking about long-term care insurance, looking at social service programs like Medicaid, or a VA benefit, which I'm going to talk about. So I always think it's important. One of the things that I always is looking at costs, because although these are numbers that are probably a little bit eye-opening and a little bit scary, these are numbers that are important to see, because again, this is sort of that long-term care, and this is why people kind of get a little bit nervous about some of the costs. So if you look at, you can go to longtermcare.gov, which links to a Genworth site that they put out every year, cost of care in your state, and it will help break down the costs of care in your area. And actually in New Jersey, they break it down into northern New Jersey, and I believe central, and then part of southern New Jersey. But just like most everything else in New Jersey, no matter what part of the state you're in, we are more expensive than many other parts of the country. And these are some stark costs. You know, the cost of a nursing home, again, long-term care, not rehab after recovering from a hospitalization or surgery, but long-term care. In a nursing home, for a shared room is about $320, private is about $380 a day in you know, central northern New Jersey. Assisted living, you know, runs about $6,500 a month and up. Adult day programs is about $80 a day. Home care is about $25 to $27 an hour, and about $280 a day for live-in care. That's that 24/7 care. So the question I always get from folks is, well, how can anyone afford this? Right? Because this is a lot of money. And so, but it's an important part of looking at the plan, because the conversation that I have a lot of times with people is they say, I have this bucket of funds that I've saved up for my life. How do I make the best use of this? And again, looking at what are the needs, what are the preferences, and what are the finances, and that sort of helps you hone in on a plan. So long-term care insurance, I'll mention this very briefly. If you're familiar with long-term care insurance, this is a type of a policy that you pay for that helps to offset the out-of-pocket costs for long-term care. If you have a policy, congratulations. That's a good thing to have because they are very hard to come by, and they are typically very expensive. If you have a policy, one of the things that I encourage you to think about or look at is take it out, and if your plan is you want to stay at home, make sure that your policy covers care at home. Some of the older long-term care insurance policies only provide coverage for care in facility settings, which if that wasn't your plan, that may be a challenge. Typically, you need to have require assistance with 2 ADLs, or activities of daily living, we call them. And that's things like help with bathing, dressing, grooming, going to the bathroom, things like that. You know, they're harder policies to come by these days. Not a lot of insurance companies want to sell these, but they are out there. They are expensive oftentimes. And, you know, depending on the coverage, you know, the cost can go up. But if you're interested in learning more about what policies are out there, again, longtermcare.gov has lots of information on their site. And I do want to mention the VA aid and attendance pension, in case any of you happen to be, you know, veterans or surviving spouses of veterans. It was sort of a well-kept secret for a long time. I think more and more people are familiar with it or have heard of it. But it provides a cash monthly benefit for wartime vets or their spouses who need help to pay with the cost of long-term. Generally speaking, there's a few eligibility requirements. You know, you need assistance with your ADLs or be living in a nursing home because you have physical, functional, or memory issues that impair you from living alone. You need to serve 90 days of active service with a minimum of 1 day during an active time of war, and then meet income and net worth limits. You know, I believe in 2020, the net worth limits, it's about $130,000. They do not count a primary residence in this calculation. The one thing that I'll keep in mind now is that the VA now, they changed this not too long ago, that they now look back for 3 years. So if your net worth was $500,000 and you want to get it below that $130,000 threshold, you can't gift it away to family because they'll look back for 3 years to make sure you haven't done any gifting. The one thing I do mention to folks is that I'm certainly not an expert in the VA benefits, but you know, because this is a cash benefit and it's a cash pension, sometimes this can, you know, combined with your typical monthly income, whether you have Social Security and or a pension, things like that, sometimes the benefit exceeds, I mean, add that in, exceeds the Medicaid limits, which now makes someone ineligible for Medicaid. I've seen this happen a couple of times, and they're, you know, can sometimes present a challenge. Typically, oftentimes Medicaid is a better option. Rather than applying for the VA benefit, typically, if we're looking for nursing home care, then applying for Medicaid is a better option. But if we're looking to pay for home care or assisted living, the VA pension is a better option. I always encourage people to consider talking about with an elder law attorney or a financial planner, someone that can help you to evaluate the pros and cons, because it's one of those benefits that you cannot give it back. Once you have started and applied and become eligible for VA benefits, you can't say, you know what, I don't want it anymore because I want to be eligible for Medicaid. You can't do that. So it's an important when we're talking about long-term planning. There's a couple of other programs here in New Jersey that are social service programs that can help offset the out-of-pocket cost. One is called JACK. This is a sliding scale cost sharing program. There's obviously some income limits for some of these programs. There's something called the Alzheimer's Adult Day Services Program that for someone who has a diagnosis of Alzheimer's disease or other types of dementia, it can help offset the out-of-pocket cost of adult day programs. And then Medicaid. In New Jersey, there's kind of 2 types of Medicaid, and this is sort of in a very broad generalization, but there's a couple of different types. The first one is what we would call historically institutional Medicaid that covers care in nursing home facilities. And then there's something called MLTSS, which stands for Medicaid Long-Term Services and Supports. And this is the kind of Medicaid that would provide care in someone's home. So to be eligible for most Medicaid programs, you need to spend down your resources and spend down your assets. You need to pay for your own stuff first out of what your assets are, and then spend down to about your last $2,000. If you're in your home, they do not count your home or a vehicle, but they pretty much, you know, any type of liquid asset must be spent down. The one thing I will mention as we're talking about aging in place is that Medicaid services under MLTSS, when you're getting Medicaid services at home, they never provide 24/7 care. So if 24/7 care becomes necessary, it may not be possible to stay at home unless you have family or other folks who can help supplement that type of care. On average, the absolute max I've seen of care under Medicaid is about 40 hours a week to be able to stay at home under Medicaid. And it's tough to get those 40 hours. So, you know, keeping in mind that if our plan is to stay at home, that may not be possible under Medicaid if we have no more asset. So I always say that safety is sort of our bottom line. You know, we need to come up with, again, looking at our needs, our preferences, our finances, and coming up with a plan that where our safety is the most important thing. If our long-term needs can't be met, whether it's due to health issues, medical issues, our finances, the home environment itself, then staying at home may not be the safest plan. And that's why I encourage people to think about contingency plans. Thinking about if for whatever reason that you couldn't remain at home, what other options might be your preference? And thinking about that before you actually need it is really, really key. So before we turn it over, I just want to give you a couple of resources. There's a wonderful template from the National Aging in Place Council that I always encourage people to download. It's ageinplace.org, and they have this great template that kind of helps you come up with a plan. It helps you outline, you know, you fill in what your expenses are and things like that, and it can help you kind of develop a plan in your own step-by-step approach. I'll give you my 2-minute little elevator speech about who I am if I'm able to ever be assistance to you. As I said before, I run the Healthy Aging program for Atlantic Health, which is essentially, it's a phone and email based hotline that people call and ask questions about literally anything related to senior services, caregiver resources. I never say I've gotten it all, but I've gotten a lot over the years. You know, I cover about 8 counties here in northern New Jersey and parts of eastern Pennsylvania. You know, in northern New Jersey, it's Essex, Hunterdon, Morris, Passaic, Somerset, Sussex, Union, and Warren counties. But if you need help outside of there, please feel free to reach out. I'm glad to help get you some contacts in the right direction. We have lots of information on our Atlantic Health website. You go to the main Atlantic page and you can look at senior services, geriatrics, healthy aging. All of those keywords will help you find our resources that are on the website. I did mention before about our new Vitality program. This is our free health and wellness program that we, under non-COVID times, we do a lot of programs and activities throughout the community. But now during COVID, we are doing a lot of programs through Zoom. So the good news is you're all familiar with Zoom. And we have lots of great free programs, exercise classes, meditation programs going on. If you're interested, there's the 844 number. You can also sign up online, or you can also contact me and I'll help get you connected with those folks. So this is my contact information. And with that, I'm gonna turn it back over to Bruce, and we can kind of take it from there.
Thank you, Rebecca. And if you stop sharing your screen.
Yep.
We have I'd like to give our sponsors tonight, SpringPoint Choice and Cecily, give us a couple of minutes to talk about what they can provide that offers a supplement to what you provide.
I'm Cecily Laidman, and I'm the Executive Director of SpringPoint Choice. I'm just going to give you a real quick background. Everything that Rebecca, it was hard for me to keep quiet because this is what I do all the time, and I'm like, wait a minute, this program is this is going to help you, this is going to help you. Anyway, SpringPoint Choice is part of a larger organization that some of you may have heard of, SpringPoint Senior Living. They are the largest senior provider in the state of New Jersey. They have communities called, you've probably heard of Stonebridge, Meadow Lakes, Monroe Village, the Oaks, so there are 8 communities that they actually have. But what I run is a program that's been around since 1998. And what it is exactly for people who want to age in their home. I mean, that is exactly what this is all about. What they took was the concept of a retirement community and said, you know, people don't want to move into a retirement community. They'd rather stay in their home. So that's what was devised back in 1998. We've been with SpringPoint for about 2 or 3 years now. and we have expanded throughout the entire state of New Jersey and all of Delaware. And what it is for people who want to remain in your home. It's a program that is going to be able to protect all of the assets. As Rebecca was talking about, the cost of services, all of those things are covered by ours. I kind of kiddingly call Spring Point Choice long-term care insurance on steroids, because it is way far beyond whatever even long-term care covers. As a matter of fact, a lot of people that have long-term care actually have this program too. So it covers all that custodial care that Rebecca mentioned. It covers that emergency response system that Rebecca talked about. It covers a person coming into your home, an occupational therapist evaluating your entire home, making suggestions about that throw rug that we're going to throw out the door because you're going to trip over it. It covers all of that. And if you ever were to need any services at home, it includes that, whether it be a home health aide or whether it be a companion or even a live-in. Then if you get to a point that you need even more care, it covers you going into an assisted living or into skilled nursing into any of our in our Spring Point communities, which is pretty cool. So the membership benefits, probably the cornerstone of this is what you have is a personal care navigator, which is a person very similar to what Rebecca does, actually. All of my care navigators are licensed social or licensed clinical social workers, and you meet that person even before when you go through the application process. And they are that son or daughter that's not dysfunctional and that you can actually listen to, and they can help you navigate anything you need. And also, for instance, what we're going through right now, all of the members that are living in their home are you know, kind of going, you know, crazy. And so they're doing Zooms and phone calls from the care navigator, making sure they're still doing well, which is pretty cool. And it's been working out incredibly well. There's the home assessment that I mentioned. The emergency response system is also included in the program. There is limited transportation, as Rebecca referred to. That is a real hot topic, but part of the program does cover transportation for those services, not just going to the doctor or not just going to out to dinner, but that it is also covered. Also, adult daycare is covered. And again, as I've said, all the homemakers, home health aides, live-ins, and if you need the services, can go all the way up to the nursing home. And you'd only be paying, what you do is you pay an upfront membership fee, and then there is a monthly fee. There's a lot of information about this, and I want to keep it, you know, real quick, down and dirty, because I want to make sure we can get questions. It is, in order to apply, you have to be medically qualified. Again, that kind of relates back to the long-term care insurance issue. So this is an ideal program for exactly what Rebecca was talking about, is planning ahead. I can't tell you how many calls and emails I've gotten from our members just over the past couple of months saying, I am so glad I'm part of this program. I don't know how I would have done without it. And there are testimonies, even especially from adult children too, that say, you know, I'm so glad that my mom or dad has this. You have to be 55 years old or older, but there is no age limit. It gets back to that, the fact that you have to be medically qualified and of course financially qualified. If any of you have never seen this, this was an article that was written on the new old age blog on the New York Times. If you're not familiar with it, it's a fabulous blog. And not just because they did a great article, but it is a really good article, but it has a lot of really, really good information. So I'd highly, highly recommend that. In the next, starting next week, we are going to be doing webinars. And at the webinar, it'll be a lot more information. You'll hear more about the financial part and everything. So I believe that Bruce has sent out a brochure, an electronic brochure, And also there is a letter that lists all the webinar dates. So that's just kind of the real nutshell version, because I don't want to take up a lot of time, and because there might be hopefully some questions. So that's the elevator speech on Spring Point Choice, and I thank you for letting me talk. And you got a great organization. You got some good peeps here.
Any
Go.
questions for Rebecca? I didn't get any questions via chat at this point.
I got one that was sent to me privately, and someone asked about the post. Can it be modified or changed by a power of attorney? And the answer is yes, it can be changed by the power of attorney unless you check off the box on the form that says the power of attorney cannot change it.
Interesting.
Another question came in about how do we find a CAPS, or the Certified Aging in Place Specialist. This is a designation given by the National Association of Home Builders. So I think you just Google National Association, and I think it's nahb.org or .com. I'm not sure off the top of my head, but they have like a member finder there.
This program and brochures regarding Spring Point will be up on our YouTube site, probably within 4 or 5 days after this presentation. If there's no other questions that people have, I want to thank Rebecca for joining us this evening. It was terrific for you taking your time, and Cecily, to your organization for sponsoring our meeting, which helps us meet our social goals, certainly. If you have questions afterwards, we'll have up on the website on YouTube Rebecca's contact information. And as we do for all our meetings that people can see, is we have a certificate of appreciation for you that we'll be mailing to you in a frame, that we really do appreciate the time you spent in contributing to our organization. If there's no other questions or further things, we can end our meeting tonight. And we certainly hope that you can, many of you join us for next month, and we'll send out an announcement in regards to what the topic will be and how to register for that meeting.
I hope you found
Any
the
questions?
meeting very educational and well worth the time. I thank you for joining us virtually once again, and I hope in a short period of time we will be able to meet back in the clubhouse and be on a face-to-face, person-to-person, and greet-to-greet. So everybody stay healthy, safe, as I say, and any questions, you could always run it by myself or with Bruce. And I thank our two speakers tonight for a very job well done and very knowledgeable and very timely. Thank you.